Hello and Assalamu alaikum. Ultrascan Diagnostics. So this is CBCT of the patient that you had requested. The area of interest is the lower anterior region, as you can very clearly see, starting with the lower lateral incisor. We've got the two quality bone, ridge width of 6 millimeters and a ridge height of approximately 16 millimeters. Moving to these teeth show periodontally compromised bone. As you can see here, this is extreme bone loss, possible mobility, 6 millimeters of width with 14 millimeters of height. Close to the apex of the tooth, you've got just 3.5 to 4 millimeters of bone. This is the central incisor on the right hand side, the central incisor on the left hand side. Again, you've got very severe periodontal bone loss, 5 millimeters of width. Near the apex, we've got 3.5 millimeters of width with 12 millimeters of height. And then this is the lateral incisor on the left hand side. Again, severe periodontally compromised, better bone than the canines, but again, very compromised, 6 millimeters of width with 15 millimeters of height. All these teeth, the lower lateral incisor actually shows quite sclerosis. So I'm going to zoom in for the kind doctor. There you go. So you can very clearly see in this CBCT that the central and the lateral incisors have very sclerosed canals. We don't see a canal architecture. We see them in the canine, but we don't see any architecture in the incisors, which proves the fact that endodontic treatment in these teeth is going to be a challenge, and extraction, while extraction, the amount of bone that we've described should be kept in mind.